30-year-old Dusabe Maria is expecting her fifth child. Like many women here at the Nachivale refugee settlement in western Uganda, she was convinced by Medical Teams International to seek professional help. The mapping of expectant mothers started 5 years ago, and more women are now surviving their pregnancies.
The women can get pregnant from outside marriage, so they are scared to go to the hospitals. Others fear because they get pregnant when they're still very young.
According to the 2022 Uganda Demographic Health Survey, the maternal mortality ratio has now almost halved, while infant mortalities have dropped more than 25%. But there's still a way to go to meet the UN Sustainable Development Goals, which aims to reduce the global maternal mortality rate to fewer than 70 per 100,000.
The aim of pregnancy mapping, like I told you earlier, is to make sure all mothers whom we know as pregnant out there in the community attains antenatal care. And the information which we record in our pregnancy diary, that is the mapping register, tells you which mother is where and when are they due for antenatal care.
When mothers first come, they gather here for group health education. They are then registered at the antenatal care unit with their medical histories and undergo an examination free of charge. Mothers with known risk factors are booked for non-emergency C-sections, while those who develop further complications undergo emergency operation. Up to 7 cesarean sections can be conducted here on a busy day. Most of the mothers handled are refugees, but 30% are from host communities and neighboring districts. But the data collected is not digitized, and that is a gap the UNHCR says needs to be closed.
But yes, the data is there. The only challenge right now that we are struggling with is it's a bit cumbersome to work with this kind of non-digitized data.
According to the latest World Health Organization data, a maternal death occurred almost every 2 minutes in 2020, caused by severe bleeding, infections, and high blood pressure, which can all be prevented. And even though there has been a slight change, it's hoped that if extended across the country, mapping of pregnant mothers could save even more lives. Razia Athman, Africa Matters, Isinjiro, Uganda.